We had, unfortunately, 390 cases of community transmission. Some are still under investigation, but at least 60 of those have been infectious in the community. And I anticipate, given the large number of cases we've had in the last few days, that unfortunately this trend will continue for at least the next few days. Main challenges remain Western Sydney and southwestern Sydney, and whilst again we've seen an ongoing stabilisation in Fairfield and Canterbury-Bankstown still has the highest number of cases, but we have seen stabilisation and the cases aren't growing the way they were in the last few weeks, which is a positive. But the health experts have asked me to highlight Blacktown and Mount Druitt as areas of concern and adjoining areas. So we're really wanting to make sure that people living in Blacktown and Mount Druitt and those adjoining suburbs come forward for testing, stay home, and if they haven't already got vaccinated and they don't have symptoms, to come forward and get vaccinated. Unfortunately, also around the Dubbo region, Dubbo in Western New South Wales is becoming a big challenge health-wise with 25 cases overnight.
And so we are concerned about Western New South Wales and why we're asking the residents of Western New South Wales and those LGAs that have been named as where stay-at-home orders are in place to really follow the public health advice. Do stay home, don't have visitors to your household, only leave your household if you have a reasonable excuse, and please come forward for testing if you have the mildest of symptoms. And we're conscious that in that part of the state, many of our Aboriginal communities often come from large families, do move around as part of cultural practice, and so hence our advice for that area to please follow the health advice. Stay home, stay within your household, only leave if you have a reasonable excuse. And as I said, operationally, we're putting many supports in place to best support our Aboriginal community in particular during this time. Thank you.